I'm delighted to join all of you. And let me just give you a perspective of uh, let me give you a perspective of what is our thinking in NITI Aayog. The National Health Policy 2017 envisions having a digital health technology ecosystem. It recognizes the very integral role of technology, e-health, m-health, cloud, Internet of Things, wearables in the health delivery. It also visualizes a national digital health authority to regulate, develop, and deploy digital health across the continuum of care. The policy advocates the extensive deployment of digital tools for improving the efficiency and outcome of the healthcare system. We are also aiming at an integrated health information system that serves the need of all stakeholders and improves efficiency, transparency, and citizen experience. The goal is to deliver better health outcomes regarding access, quality, affordability, lowering of disease burden, and efficient monitoring of health entitlements to citizens. We've been making efforts towards having a national digital health platform with the concept of National Health Stack, which eventually evolved into the National Digital Health Blueprint and now launched as the National Digital Health Mission by the Prime Minister on 15th August this year. Parallel efforts were going on in the form of integrated health information platform, whose primary objective is towards the introduction of EHR into the medical system with a focus on the continuum of care, and PM Jan Arogya Yojana 2.0 IT platform, which aims at the integration of insurances and other provider level platforms. Eventually, both of these will be integrated to complete the loop. The National Digital Health Mission is a technological leapfrogging to ensure equitable healthcare services delivery in India. The National Digital Health Mission launch has ushered India into a new era of technology-enabled healthcare delivery. A unique health ID will be created for each individual and will provide access to integrated services across different tiers of healthcare delivery. This is critical to help realize universal healthcare. The current focus is on health ID, health facility registry, personal health records, telemedicine, DG doctor, and e-pharmacy. Over the past 2 years, the country has been facing an unprecedented public health crisis in the form of COVID-19. Since the onset of the pandemic, our state governments have responded with various innovative measures to contain the spread of the virus. The unprecedented challenges caused by COVID-19 were managed collectively by governmental and non-governmental support. The changing dynamics of the COVID-19 infection called for early identification, remote monitoring, and appropriate referral mechanism to reduce the number of severe cases and deaths. The National Teleconsultation Service of Ministry of Health and Family Welfare is the first online OPD service offered by a country's government to its citizens. The National Teleconsultation Service is providing healthcare services to patients in their homes, and safe and structured video-based clinical consultations between a doctor in a hospital and a patient in the confines of his home are being enabled. eSanjeevani, a doctor-to-doctor telemedicine system deployed nationally for the Ministry of Health and Family Welfare at 155,000 health and wellness centers under Ayushman Bharat scheme of Government of India, was also launched. We enabled, at the peak of this crisis, we came out with the telemedicine guideline and pushed them vigorously. ABSWCs is envisaged to be the platform of delivering an expanded range of primary care services closer to the communities. The digital public good created during the pandemic continues to gain traction and has achieved more than 5 million cumulative teleconsultations till December 2021. Offered at no cost, this e-health service has made it convenient for people to avail themselves of the health services without traveling. It enables two-way interaction and even generates a prescription slip. These platforms, using available telehealth, home testing, e-pharmacies, and other digitally powered offerings even without much innovation by large healthcare providers. 65% of today's e-commerce users would also use digital health solutions. Significantly higher adoption of digital health tools was reported by patients who had long-term disorders such as cardiovascular diseases, diabetic, and hypertension. The pandemic forced people to use digital channels for care needs. Having experienced the benefits of digitally enabled healthcare delivery, consumers now consider them necessary. However, as too often in India, supply lags well behind demand. The underpinnings are already there. India now has a sturdy digital backbone via Ayushman Bharat Digital Health Mission. We were able to do vaccination completely digitally, unlike the rest of the world. The COVID platform was an entirely digital process, unlike in USA or UK. Aiming to capture health data across physicians, providers and patients, the Ayushman Bharat Digital Health Mission platform will provide interoperability, flexibility, security, scalability and complete access. It is now up to the healthcare providers, startups, technology providers, investors and other stakeholders to develop digital health offerings that meet and stimulate demand. Like nature, the economy abhors a vacuum. Those who delay could find that others have already captured the opportunities. There will be a technological leapfrogging in the field of health, and this is a huge opportunity. At the moment, opportunities abound. India needs compelling, accessible healthcare solutions that provide equitable access and can be rapidly deployed and scaled up. Conventional healthcare capacity is doubtful to catch up with the demand and supply gaps. The country suffers now, and therefore it is very necessary that digital solutions are the answers. They build on the deep penetration of smart devices and increased connectivity that the government has invested in over the past decades. The pandemic catalyzed the adoption of telehealth, home health, e-pharmacies and other digital offerings. But there's still a lot of room for growth. Meanwhile, some solutions remain largely unexplored, including e-diagnosis, tech-enabled home health, and more mature e-pharmacy solutions. For conventional healthcare players, health technology startups and investors, this is the best time to enter and build a position which will be hard to beat in subsequent years. This is an opportunity, and I would request each one of you to capitalize on this by technologically leapfrogging. I take this opportunity to wish Dr. Harsh Mahajan and his entire team all the very best and all success in this endeavor. This is a unique opportunity to work in partnership with all of us. We'll be here to provide all assistance and support to Dr. Harsh Mahajan in his very successful, to enable him to have a very successful tenure as the head of NATHEALTH. Thank you very much, ladies and gentlemen.